On any given day, I have both clinic and surgery. In clinic, I'll see consults for patients with skin cancer, lesions on their eyelids or face, droopy or excess skin of their eyelids, droopy brows, or other cosmetic concerns that they have. On the day of your consultation with me, you'll be greeted by one of my assistants. You'll answer a few simple questions and undergo a few tests, which include a series of preoperative photos. Once in the room with me, we'll get to the bottom of what your cosmetic concerns are. We'll take a series of measurements of your eyelids and face, and we'll come up with a customized plan to address all of your concerns. Blepharoplasty is a surgery that's done to remove the extra skin of the upper eyelids. This can be considered both medical in some patients or cosmetic if we're looking to just sharpen and refreshen the look of someone's face. The typical person that would benefit from a blepharoplasty is someone that notices that their eyelids are starting to get heavy. Many times they'll feel like they have to raise their eyelids to see better or lift their eyelids. And a simple consultation with me, we would do a visual field test where we checked if there's any loss of your peripheral vision, as well as taking a series of photos that would be submitted to your insurance company. Similarly, there could be extra skin or sometimes even fatty tissue in the lower eyelids. In this case, lower lid blepharoplasty is always considered a cosmetic procedure, but it's one that greatly improves the quality of life of patients. They make you see better, feel better, and look better. There are different levels of anesthesia that patients can receive for blepharoplasty surgery. The most common is just local anesthetic, where we inject the numbing agent underneath the skin. For those patients that are a little bit anxious about the process, Xanax goes a long way, and we would give that prior to the procedure. Other patients would benefit from a gas called Pronox, which is a combination of nitrous and oxygen, similar to laughing gas. After blepharoplasty surgery, you're going to want to do lots of ice, 20 minutes on, 20 minutes off for the first 3 days in order to stay ahead of the bruising and swelling. After your first 3 days, you're going to switch over to warm compresses. This will bring in good circulation and blood flow to the area and promote healing. During the post-op period, you'll also be applying antibiotic ointment to your incision line. This will help with the healing process and prevent infections. A lot of patients ask me, am I allowed to shower? Please, we encourage showering. Keep yourself nice and clean and prevent any other infections from forming. Another common question that I get after blepharoplasty surgery is, when can I start using makeup or wear contact lenses? I tell my patients that we give about 10 days of recovery time before we do these things, in order to avoid tattooing of the wounds or stretching of the skin while placing our contact lenses. Facial injections have become incredibly popular. The two more popular varieties are your Botox or botulinum toxin type of injections and your filler injections. For Botox, Botox is a neurotoxin that is injected into several of the facial muscles to prevent dynamic wrinkles. What that means is when you animate the face and make these lines, that's what Botox helps control. On the other hand, filler injectables are made of hyaluronic acid. This product, like the name implies, fills a space and helps bring wrinkles out and make them less prominent. Our two most popular energy-based devices for facial rejuvenation are IPL, Intense Pulse Light, which is a great product for helping with facial photoaging that happens through the sun, so spots, rosacea, pigmentary issues. And then we have CO2 laser, which helps with fine line wrinkles and tightening of the surface of the skin. Both of these modalities are many times combined when we do our other facial surgeries, such as our lower lid blepharoplasties, in order to harmonize and achieve the best possible outcome for our patients.
What is blepharoplasty?